The intent of the operation is to last, and certainly by creating the small gastric pouch, you achieve restriction. By creating the bypass, you achieve some sort of malabsorption and also alteration in gut hormones. And this combination leads to the fantastic weight loss and resolution of comorbid illnesses. But certainly over time, things can change, and we know that certainly the pouch can stretch. We theorize that the hormonal alterations induced by the surgery can actually change over time, and that's something we're studying now to see what those changes exactly are. And one of the key components is actually certainly the patient and their lifestyle itself. So if a patient is undergo an operation, that's a one-time procedure. But if they haven't had proper counseling and they haven't been educated on proper lifestyle and sort of proactive interventions they can make, then certainly over time there is a rate of recidivism. So I think it's a combination of several factors. Is once you've had a gastric bypass, you can't really get a sleeve gastrectomy, a surgical sleeve, because you've already created the small pouch. Oftentimes, we can sort of lengthen the bypass again, and that's actually quite effective. So oftentimes when we see patients who have extreme obesity, so they've undergone a gastric bypass, regained weight, and now they're back in the extreme obesity categories, then oftentimes revising the bypass surgically is actually the best option because it's going to give you the most robust weight loss and the best outcomes with regard to that. Yeah, so we know that over time, up to a quarter to a third of patients will actually have significant weight regain. And we also know that probably anywhere between 25 and 30% will also fail to become unobese after the initial operation. So in other words, an operative failure. So it is a significant number of patients that we're dealing with, and most of these patients will present anywhere from 8 to up to 15 years after the operation with these problems. There's certainly several other providers around the country that are doing this, as well as worldwide. So for now, it's restricted to mainly tertiary care centers and some community practices, although it's still pretty sparse at this point. We're still at less than 100 patients here at UCLA, and one of the issues that we encounter is there's a lack of education. So many patients don't know what to do once they've regained the weight, and there's certainly a lot of stigma associated with it, both in society as well as medically. And they feel that certainly they've blown their chance or failed. And so oftentimes both patients and primary care providers aren't aware that there are other options out there for the patients. And so we found through our own sort of regional outreach efforts, we certainly have had a lot more patients recently coming in inquiring about the procedure. Most patients who have undergone this bypass, once they've gone through it, we really kind of throw up our hands. So once they've regained weight, I think the burden oftentimes falls on the endocrinologist, the primary care physician, and it's a difficult process to manage. And so I think gaining awareness for all of the physicians, I think, is important, just to know that there's an option there, and there's a minimally invasive treatment option, and it may not be for everyone, but certainly I think being aware of that option is the most important thing.